Bon après-midi à tous et à toutes. Good afternoon, everyone. Le Nouveau-Brunswick fait présentement face à sa plus importante vague de COVID-19 à ce jour, la vague Omicron. On m'a demandé aujourd'hui de vous fournir des précisions sur ce à quoi pourrait ressembler cette vague et sur ses répercussions possibles. New Brunswick is currently experiencing its largest COVID-19 wave to date, the Omicron wave. Today, I've been asked to provide you with some details of what Omicron could look like and what its impacts could be. As we know, the Omicron variant is highly transmissible, and though milder than the Delta variant, it is by no means mild. For every 1,000 cases under Delta, we would have expected 60 admissions. With Omicron, we now expect 10. While better, this is still enough to put our health system at risk due to the sheer volume of cases. Cette diapositive montre le nombre de cas signalés par jour depuis le 1er septembre 2021. En octobre, nous avons fait face à la plus importante vague jusque-là, enregistrant 140 cas en une seule journée au plus haut point. You can see on this slide our number of daily recorded cases since September 1st, 2021. In October, we went through what was, at the time, our worst wave to date, recording 140 cases in a single day at our peak. When accounting for individuals registering their POCT results, we are now recording well over 1,000 cases per day, and we know that this is underreported. This is above and beyond our capacity to continue testing and recording accurately. Yet we're starting to observe this affecting our total number of hospitalizations. Today we report 88 active hospitalizations, a new high for the province. This experience is not unique to New Brunswick. In fact, in many ways, this is the first truly national experience of COVID-19 we have had since the beginning of the pandemic. Des nombres records de cas sont présentement signalés dans chaque province et territoire, et le nombre d'hospitalisations continue d'augmenter, certaines provinces atteignant des taux jamais vus jusqu'ici. Every single province and territory is now seeing record case counts and are experiencing a rise in hospitalizations, with some provinces reaching highs never before seen. On the screen, you now see the 7-day average for active hospitalizations shown for every 100,000 people. This allows us to demonstrate how New Brunswick directly compares to other provinces. We can see that on January 8th, other provinces such as Ontario and Quebec were at levels 2 to 3 times higher than where we were at that point in time. This provides a stark picture of where we are likely heading. You will now see on your screen, on the left, our projected number of cases over the coming weeks, and on the right, the corresponding increase in hospitalizations over that same time period. These models were built in collaboration with our colleagues at the University of New Brunswick and are based on our current situation. Comme vous pouvez le voir, si ces tendances se maintiennent, nous atteindrons le nombre plus élevé de cas vers la fin du mois de janvier, début du mois de février. Il y aurait alors tout près de 5 500 nouveaux cas par jour et près de 220 hospitalisations actives. As you can see, if these trends hold, we expect to reach our peak towards the end of January, early February. This would represent close to 5,500 cases daily and nearly 220 active hospitalizations. As trends decrease, we expect to be where we are today in about 5 to 6 weeks' time. In terms of cases, isolation requirements will undoubtedly impact our healthcare capacity. We will be hit on both ends. However, the implications are broader. At our peak weeks, we can expect over 5,000 New Brunswickers developing the disease daily. Over a 5-day period, this would be about 25,000 individuals. Assuming 2.3 individuals per household, this could mean over 7%, or approximately 55,000 people, isolating at any given moment. When you factor in longer isolation periods, for example, for unvaccinated children, this number will likely be higher. This will impact not only our healthcare system, but also other critical services, such as fire departments, police departments, power services, and so on and so forth. It will also impact large and smaller businesses, as workers either require sick time or isolation time. We are in this together, and there is something that we can do. You can now see our projections should we note a reduction in our contact rate by Friday, January 14th. On your left, you will see the projected impacts on cases, and on your right, the projected impacts on hospitalizations. The yellow line shows us our expected path forward. The pink line shows what we would expect to see if contact rates are reduced by 10%, and the blue line shows the same, but with a reduction of 20% in our contact rate instead. We all have to do our part in reducing the number of contacts that we have. Si nous pouvons réussir à réduire nos contacts, entre autres en fréquentant moins de gens, en pratiquant la distanciation physique et en portant des masques bien ajustés à l'intérieur, notre plus haut point pourrait alors être coupé par 1/3 de ce qui se produira s'il n'y a aucun changement de comportement au sein de la population. If we were able to reduce our contacts through either seeing fewer people, distancing appropriately, or wearing well-fitted masks inside, then our peak may be cut by 1/3 of what would happen without any changes in public behavior. As I said earlier, Omicron is much more contagious than the other variants we have seen. It is everywhere in this province, and we need to assume that everyone we come in contact with could have it. The next few weeks will be intense, but they will not last forever. We will get through this. My message to New Brunswickers today is this: the best way to prevent COVID-19 right now is to reduce your contacts. This small action will protect your family, reduce strain on the healthcare system, and protect our economy. Mon message à la population du Nouveau-Brunswick aujourd'hui: la meilleure façon de prévenir la COVID-19 à l'heure actuelle consiste à réduire les contacts. Ce simple geste protégera votre famille, réduira la pression exercée sur le système de santé et protégera notre économie. The severity of this wave of Omicron is in your hands to control. Thank you. Merci.
Merci, Mathieu. Bonjour après-midi. Oh, bon après-midi à toutes et à tous. Good afternoon, everyone. Depuis plusieurs mois, nous répétons que nous devons apprendre à vivre avec la COVID-19. Pour bon nombre d'entre vous, cet énoncé a pris un sens nouveau et plus immédiat ces derniers jours. Aujourd'hui, tous les citoyens du Nouveau-Brunswick doivent vivre avec la COVID-19 et pas seulement indirectement en raison des cas confirmés dans la province ou leur collectivité. Pour bon nombre d'entre nous, il y a des cas dans nos maisons et nos familles. For the last several months, we have been talking about living with COVID-19. For many of you, this phrase has taken on a new and more immediate meaning in recent days. Today, every New Brunswicker is living with COVID-19, not just indirectly because there are confirmed cases in our province or community, but for many of us directly in our homes and with our families. The Omicron variant has significantly altered the course of this pandemic. Because it is more contagious and incubates more quickly than earlier strains of COVID-19, we are seeing a rapid spread of the virus in every corner of our province. We are experiencing record numbers of confirmed infections and more people hospitalized for COVID-19 than any time since the pandemic began 2 years ago. This has brought COVID-19 into the lives of every New Brunswicker in a way that most of us have not experienced before. In some ways, this has been the biggest change brought on by the Omicron variant. Au cours des vagues précédentes, vous ne connaissiez pas nécessairement une personne qui avait contracté la COVID-19. À l'heure actuelle, le virus est omniprésent. Cette situation ne durera pas éternellement. In past waves, you might not have personally known a person who contracted COVID-19. Now it is everywhere around us, and this won't last forever. This is a phase of the pandemic which we will get through as we have gotten through all the stages that preceded it. This storm will pass, but we are in for several weeks of very bad weather. And the gathering storm could include record hospitalizations at the same time as high numbers of healthcare workers are in quarantine because they are COVID-19 positive. Since Christmas Eve, staff in the Department of Health, the regional health authorities, and EMANB have been working tirelessly to address this situation. They have agreed to reorganize services inside facilities, then reach to nearby hospitals, and then to support each other provincially as necessary. And I just want to commend the work that all of these people are doing within these organizations, as well as the frontline staff, who are understandably exhausted. This will make sure that critical life-saving services are delivered to New Brunswickers, and this is key. In the weeks ahead, we will need to look after ourselves, care for one another, and protect those who are tirelessly working to keep us all healthy and safe. Given the rapid spread of the Omicron variant, it is very likely that most of you will have direct experience with COVID-19. Vous pourriez vous-même contracter le virus, devoir prendre soin d'un membre de votre famille qui l'a contracté ou devoir appuyer des membres de votre famille, des voisins ou des amis qui sont malades après avoir contracté le virus. Nous devons tous nous préparer aux répercussions de la COVID-19. Il faut tout d'abord se faire un plan. You may contract it yourself, be required to care for an infected family member, or be called upon to support family, neighbors, or friends who are ill due to the virus. We all need to be prepared for COVID-19, and that begins with making a plan. Please make sure that you have the right supplies on hand. You will be needing these to care for yourself and others, including things like tissues, medications for pain relief, a thermometer, easy-to-prepare meals, soups, Gatorade, Pedialyte for hydration. Faites le plein de fournitures dont vous aurez besoin pour vous soigner et prendre soin des autres, comme des papiers mouchoirs, des médicaments pour soulager la douleur, un thermomètre et des repas faciles à préparer, comme la soupe, et aussi des choses pour des liquides comme Gatorade ou Pedialyte. Watch for symptoms of an emerging infection. Be aware of school and workplace policies for responding to this illness. Determine who you can count on for assistance when you need it most, and make sure these people know that they can count on you too. Déterminez qui pourra vous aider quand vous en aurez le plus besoin. Assurez-vous également que les autres sachent qu'ils peuvent compter sur vous eux aussi. Maintain the smart practices that have served us throughout the pandemic. Wear a mask, maintain physical distance from others, wash your hands regularly and thoroughly, and limit your contacts as much as possible. And most important of all, get vaccinated. Make sure you have your first 2 shots and get a booster shot as soon as you are eligible. And really, of the 88% people hospitalized today in New Brunswick, 24% of them have had their booster, so it's not that it eliminates the risk, but it diminishes it greatly, while 76% of the hospitalized individuals are either unvaccinated, partially vaccinated, or it's been 6 months since their last dose. As of yesterday, all New Brunswickers over the age of 18 can receive a booster shot if more than 5 months has passed since their second dose of the COVID-19 vaccine. Make sure your children are vaccinated. The COVID-19 vaccine is safe and effective. It is the best way to offer our kids the stability they need and get them back to school and the activities they love. These layers of protection will help guard against the worst effects of the COVID-19 virus, including severe illness, hospitalization, and death. By being prepared ahead of time, you will much better be much better positioned to look after yourselves and your loved ones if you become infected. If you and your family are vaccinated and boosted, your experience of COVID-19 may be fairly mild. And I'm going to qualify this term mild. When we are talking about mild, we're talking about the fact that you most likely will not need hospitalization. But that doesn't mean that your symptoms will be completely benign. Symptoms can range from fever, aches and pains, sore throat, and coughing, but they can be more severe, including fatigue and chills, shortness of breath, nausea, and dehydration. If you do contract COVID-19, rest and stay well hydrated. Non-prescription medications like Tylenol and ibuprofen can help with pain and fever relief. You may also want to use a humidifier or steam from a shower to ease cough or sore throat. The Omicron variant is highly contagious, and caring for someone with COVID-19 requires that you take steps to limit its spread within your household. And I have heard from my team, you know, there's messages on the internet, but also I've heard the success stories of where somebody did successfully isolate within the home, and it really was around staying in one room, and that person wouldn't leave that room for any reason, and if they did, they would be wearing their mask. But so doing your best to separate from the infected person is the most important thing. They should sleep in a separate room and not participate in family meals or activities. They should use a separate bathroom if one is available, wear a mask when leaving the room. They should not share personal items with others, such as utensils, food and drink, phones, TV remotes, and also in the situations where we heard that the virus did not get transmitted, people would bring the food to the person's room but not take any dishes out. They just left them there, and sometimes they would use disposable plates and utensils, etc. When you are caring for a person with COVID-19, please remember to wear a well-fitted mask when you are with the infected person. Medical masks like N95s are the best, but non-medical 3-layer masks can be used if they fit well and completely cover your mouth and nose with no gaps. Les masques médicaux, comme le masque N95, offrent la protection maximale, mais les masques non médicaux de 3 plis peuvent aussi être portés s'ils sont bien ajustés et couvrent complètement le nez et la bouche de façon étanche. The infected person should also wear a mask when in close contact with caretakers and other family members, but again, avoiding contact is the best. They should be masked when they are in common areas, such as the kitchen, bathroom, or TV room of your home, but again, I don't recommend that they're in the same room at all. If you do have a separate bathroom for the infected person to use, there are steps you can take to limit the spread of infections, such as opening windows, closing the toilet lid before flushing, and regularly cleaning high-contact surfaces, such as door handles and faucets. Most cases, particularly among those who are fully vaccinated and have a booster dose at 5 months, should be able to recover at home. But there may be times when medical care is required. We encourage you to call your primary care provider or telecare 811 for assistance first. If you receive a positive PCR test, you will receive a health check call to ensure you have access to community health services. This is why our more vulnerable 50 and older population are directed to get a PCR test when symptomatic, along with other priority groups, including healthcare workers, or those who live and work in long-term care facilities, homeless shelters, correctional facilities, people who are immunocompromised, pregnant, people who are identified as a priority by public health, and people who live in First Nations communities, and children under 2 are also eligible to receive a PCR test. We have pivoted our point-of-care testing programs to ensure the public and employers use them judiciously to identify positive cases and to protect individuals in their homes and workplaces. With rising cases, we will need to use our supplies to target those who are symptomatic. Cependant, des soins médicaux pourraient être nécessaires. Composez immédiatement le 911 si vous observez ou ressentez ces symptômes. Beaucoup de difficultés à respirer, douleurs ou pression thoracique, apparition de confusion mentale, difficulté à se réveiller. Call 911 immediately if you see or experience these symptoms: significant difficulty in breathing, chest pain or pressure, new onset of mental confusion, difficulty waking up. If an ambulance is required, be sure to tell the dispatcher that this is a case of COVID-19 so that paramedics are prepared to deal with your situation. If you are able to get yourself to a hospital, have your caregiver drive you. Don't take a bus or a taxi. Both the patient and driver should be masked and sit as far apart as possible. And please also consider having a plan for who will look after your children if you have COVID-19 and are unable to. As important as it is to know how to care for someone who has contracted COVID-19, it is just as vital to know how to take care of yourself. These are very stressful times for all of us, and it is not unusual to feel grief, sadness, and frustration about what is happening all around us. Especially if you are caring for others, you need to look after your own physical and mental health. Make sure that you eat healthy and well-balanced meals, get plenty of sleep, take regular breaks that provide an opportunity for diversion and relaxation. Exercise regularly outdoors in the fresh air whenever possible. Take your news from trusted sources and be conscientious and cautious of your use of social media. Above all, stay connected with friends and family. Call a friend or a loved one. Let them know that they are needed in your life and that they can depend on you as well. Now more than ever, we still need each other as we weather this storm. Le printemps sera bientôt là et des jours meilleurs nous attendent. Veillez à votre propre sécurité et prenez soin de vos êtres chers afin que nous puissions tous y arriver ensemble. Spring will come and there will be better days ahead. Keep yourself safe and look after those you love so that we can all get there together. Thank you very much. Merci.
Bonjour à tous et à toutes. Good afternoon, everyone. Je suis contente d'être parmi vous aujourd'hui dans le but de vous présenter un rapport de situation pour le réseau de santé Vitalité. Comme M. Chalifou et Dr. Russell l'ont mentionné, la 5e vague de la pandémie avec l'arrivée du variant Omicron frappe le Nouveau-Brunswick avec une rapidité et une intensité que nous n'avons pas encore connues lors de cette pandémie. Je veux assurer la population que le réseau de santé Vitalité et tous les intervenants du système de santé travaillent en étroite collaboration pour traverser cette crise. Les 2 réseaux de santé sont passés au niveau d'alerte rouge le 31 décembre dernier. Concrètement, ceci veut dire que plusieurs services et soins de santé non essentiels sont réduits ou interrompus temporairement. Toutes nos équipes sur le terrain sont mobilisées et nous surveillons l'évolution de très près. Notre objectif demeure le même: maintenir les services essentiels à la population, malgré la hausse des hospitalisations COVID et les pénuries de personnel qui sont à prévoir en raison du comportement de ce variant. Nos priorités sont de maintenir les services essentiels comme les services d'urgence, les chirurgies urgentes, les soins intensifs, les services de dialyse, les services d'obstétrique, les services d'oncologie, la prise en charge des patients atteints de la COVID-19. En date d'aujourd'hui, nous avons 42 patients atteints de la COVID-19 qui sont hospitalisés dans nos établissements, dont 4 sont aux soins intensifs. Le taux d'occupation de nos hôpitaux demeure très élevé, soit 94 %. L'une des particularités de cette 5e vague et du variant Omicron est sa grande contagiosité, qui fait en sorte que malgré toutes les précautions qui sont prises, un grand nombre de nos travailleurs de la santé sont atteints et un plus grand nombre risque de l'être au cours des prochaines semaines. Le réseau compte en ce moment 142 travailleurs de la santé qui ont dû être retirés du travail en raison d'un diagnostic positif à la COVID. Basé sur l'expérience acquise depuis le début de la pandémie, particulièrement dans les régions de Campbellton et d'Edmundston, nous avons continuellement testé et bonifié notre plan de pandémie. Pour faire face au comportement d'Omicron et au manque de ressources prévues, nous avons séquencé en 3 niveaux d'intensité un plan dans lequel nous avons identifié différentes actions à mettre en place, toujours pour sécuriser nos services essentiels. Nous sommes maintenant à la ligne entre le niveau léger et modéré d'absentéisme. Certaines actions ont déjà été mises en œuvre, comme le retour précoce de nos travailleurs de la santé qui ont eu des contacts étroits ou qui ont eu un diagnostic positif de COVID. Ces interventions séquencées peuvent se faire au niveau de l'établissement, de la zone ou en collaboration avec d'autres zones lorsque la situation l'exige. Lors des dernières éclosions, il a été possible de gérer la situation grâce à la collaboration de tous pour mettre en œuvre une série de mesures, telles que limiter la gamme de services, limiter les raisons pour les nouvelles admissions, toujours dans le but de préserver les services essentiels qui permettent de réaffecter du personnel vers d'autres secteurs critiques. Collaborer entre les secteurs d'un hôpital, avec d'autres hôpitaux de la zone ou d'autres zones ou avec notre collègue, le réseau de santé Horizon, lorsqu'un certain niveau de capacité est atteint. Face à cette situation, nous avons partagé nos apprentissages avec tous nos partenaires qui travaillent tous en collaboration afin d'établir des approches provinciales pour faire face aux différents scénarios de pénurie de personnel, même les plus pessimistes. En parallèle, nous travaillons sur d'autres fronts en ce moment afin de réduire le taux d'occupation des hôpitaux, accélérer le placement des aînés des établissements de soins de longue durée, améliorer l'accès aux soins de santé primaires afin d'éviter des hospitalisations, assurer la mobilité de notre personnel. À cela s'ajoute toujours notre travail pour la vaccination et le dépistage de la population. Au plus fort de la crise, les gens du Nouveau-Brunswick devront sans aucun doute se serrer les coudes et démontrer, encore une fois, un niveau d'entraide et de compassion comme jamais auparavant. Le réseau doit aussi gérer plusieurs avis d'exposition et des éclosions dans bon nombre de ses unités de soins. La situation est particulièrement sérieuse à l'hôpital régional d'Edmundston, où le réseau a dû déclarer l'hôpital en état d'éclosion vendredi dernier. L'expérience acquise lors des vagues précédentes nous a bien préparés à gérer de telles situations dans nos hôpitaux. Nous avons démontré et nous démontrons encore une grande capacité d'adaptation et c'est encore le cas à Edmundston en ce moment. Je remercie les gens de la région du Nord-Ouest pour leur collaboration et les assure que tout est en place dans leur hôpital régional afin de faire face à la situation. Il y a une statistique que je tiens à vous partager. Elle est très importante. La 3e dose de vaccin offre une protection qui contribue à réduire les hospitalisations jusqu'à 88 %. La vaccination est toujours une pièce maîtresse dans notre lutte à finir contre le COVID. Je vous implore de vous faire vacciner le plus vite possible. Le réseau de santé Vitalité continue de travailler avec les gens de la province, ses employés et ses médecins dans le but de gagner la bataille. Et on vous demande de faire votre part, encore une fois, en vous faisant vacciner, en respectant les mesures sanitaires, en minimisant vos contacts, en minimisant vos visites aux hôpitaux, sauf pour des situations urgentes, bien entendu. En terminant, je tiens à souligner l'appui du ministère de la Santé ainsi que de nos partenaires, le réseau de santé Horizon, Ambulance Nouveau-Brunswick, Programme extramural et le ministère du Développement social. La collaboration entre tous ces joueurs du système de santé est exemplaire et va nous permettre de traverser la tempête. Je tiens également à remercier les intervenants de la santé, c'est-à-dire les employés et les médecins du réseau, pour leur engagement et leur détermination infaillible. Je sais que vous êtes plusieurs à les remercier et à les reconnaître. Merci de les encourager, ils font un travail extraordinaire. Merci pour votre attention. Thank you.
Good afternoon, everyone. I'm John Dornan. I'm the interim president and CEO of Horizon Health Network. We're not done with COVID yet by any stretch. You know, I have an optimism every day when we don't have 1,000 admissions that maybe this is not going to affect us. Maybe this is going to pass. And that's just inappropriate optimism. We are at the start of a very high tidal wave. It's creeping up now, but in the next 2-3 weeks, it's going to crash over us like no one's business. We have seen rises in cases in adjacent provinces, Ontario, Quebec, there's no reason to believe that we are not going to be affected in the same way. And to not be prepared for that would be irresponsible. We are near the 2-year mark, but the worst is yet to come, and it's not going to come over the next 6 months. It's going to come over the next few weeks. We're seeing a rapid increase in the infection rate in our communities, as is the case with Omicron, and that will translate statistically into admissions to our hospitals. I look at the daily stats, and I know that they are growing. The number of people that are coming into the Horizon and Vitalité hospitals continue to increase. And in normal circumstances, we might be able to tolerate that to some extent. Every day, we have 250 employees that are not able to turn up for reasons of, I'll say, vacation, illness, long-term disability. Today, we had 164 people not be able to turn up because they had COVID or COVID associations or connections. We can't work with that reduced staffing environment. As is the case, and as Dr. Desrosiers mentioned, we have to have plans. And we are beyond the first level of each of the plans that we have now. For example, when our staff are a COVID contact or a COVID positive case, in conventional times we'd say stay home for 10 days, get a point of care test, and then come back in again. That's a conventional approach. In all of our hospitals, we are at a contingency approach, which means that after 5 days of home isolation, and you test negative, you can come into work. We are not encouraging you to stay home for 10 days. We're asking you to come back after 5 days. We have further phases in what we do if we are shorter staffed, and in some of our hospitals, some of our units currently, we are at a crisis level where we are asking people to come back even earlier than 5 days. You know, in the past, we would make plans for an outbreak area in 1 or 2 of our hospitals and 1 or 2 of our units. At the St. John Regional Hospital, we have outbreaks on 6 units currently. It would be inappropriate to say that we have more outbreak than non-outbreak units, but 6 is a large number, and these are not small units. To give an example, it's neurosurgery, obstetrics, internal medicine, family medicine, ALC units. These are the breadth of our hospital. In fact, we're at a point now where we're not able to contain all of our affected and close contact patients in 1 or 2 areas. We have to start to consider additional plans where we would look after people in split units where half the patients might be under isolation, the other half might not be COVID infected. So we are working along a phased approach. We're beyond the first phase, we're not at the last phase, but we are doing that in cooperation with government leadership and Vitalité. Another example of a phased approach is, you know, as we run short of staff, we gradually reduce the non-critical emergency services in each of our facilities. That's already started. And then we start to look at what folks from other areas could help us. Throughout Horizon, at some point, we will be welcoming staff from Vitalité if they have adequate staff. And we have reached out to people in our community that might have worked with us recently, ER nurses, ICU nurses, and I'm pleased that a plan has been evolved that would make it attractive for people to come back and help us out in a time of crisis. I did illustrate St. John Regional Hospital. Because of the number of outbreak areas, we don't have a facility that doesn't have some outbreak area. And when we have programs like the Heart Center, like neurosurgical centers, we can't simply close the door on such hospitals, so we do our best to keep them open, care for people appropriately, and separate where at all possible patients that don't have COVID. You know, we have 88 people in our hospital today with COVID. It's an alarming statistic that 35 of those people didn't come in with COVID. They came in with something else, a leg fracture, pneumonia, heart disease, and acquired COVID in our hospital. So if at all possible, if you find another way to deal with your medical symptoms that might not be urgent, but might be cared for by your family doctor, your nurse practitioner, pharmacist, virtual care, and we'll hear plans over the next few days about what that might look like. We know that seniors are affected by COVID more seriously than other people. A large fraction of our population is senior cares, and some of those people, we don't have the resources to send them home at this point in time. We are looking at doing that better in cooperation with social development, our social workers, our discharge planning, and so we're hopeful that that will give us some hope. You know, we have cut back on surgeries quite a bit. Currently, in Horizon, we have canceled over 360 surgeries over these last few weeks. And these are surgeries that need to be done. We've used the term elective in the past. There's no elective surgery. These are surgeries that need to be done to reduce pain, improve mobility, improve health. And so we've had to postpone that, and we don't like to do that. We continue to provide emergency, life-saving surgeries, and as well surgeries for people that have cancer that cannot wait another 2 or 3 weeks. So we continue to do that and are hopeful of still providing the essential care that we want to give. You know, I hear the statistics about reducing contacts, and you know, if I had to give a message, it wouldn't be anything that I've reported to you thus far. It's the message, what reducing contacts does. And we heard Mr. Chalifoux talk to us about if you could reduce your contacts by 30%, we might, I'll use an old term, flatten that curve in terms of the impact on all of our healthcare facilities. So I would strongly encourage people to do that. You know, I try to think about it in realistic terms. What if for the next 10 people I might be in contact with at a grocery store or other words, what if I cut that back by 3 people? And every time considered what people I needed to cut back. So I'd like to close it off now. Be very thankful for all the healthcare workers that we work with in Horizon, in Vitalité, in Amherst, New Brunswick, the extramural program, and our government colleagues. And it's by working together as a team and a phased approach will we beat this pandemic. Thank you very much.
Merci beaucoup, Monsieur Chalifoux. Doctor. Thank you, doctors, and Mr. Chalifoux. We'll now proceed with questions from members of the media. Each reporter will have 1 question and the right to pose their question in the official language of their choice. Nous allons maintenant procéder aux périodes de questions avec les journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. We will now start with Ailish Bonang of CTV.
Hi, folks. Are you able to hear me?
Yes, thank you.
Perfect. Thank you, Bruce. My question can be for Dr. Russell. Given the very grim outlook of what hospitalizations are likely to look like in the coming weeks, why is the province not implementing more lockdowns, more restrictions, and really getting behind them to try and get ahead of this current situation?
Thanks, Ailish. Lots of people asking that question these days. And we have triggers to have our discussions. We're definitely following the situation really, really closely, hour by hour on a daily basis. So there's no question that trying to balance the risks of what's happening right now in our healthcare system versus the consequences, unintended consequences, negative impacts of more restrictive measures at this time, again, has to be balanced in our discussions, which we are having actively. So right now, we're again, Mr. Chalifoux presented all of the epidemiological projections. And so again, we're keeping that in mind. The briefing today is really about how to make sure that New Brunswickers understand the situation as it is today, what actions they can take personally, again, around keeping their close contacts low, getting vaccinated, getting boosted, et cetera. Those are really important things to keep in mind right now. And we will continue to monitor the situation extremely closely. again, it's not a decision that would be taken lightly, but it's definitely something that we're monitoring very closely.
Thank you. We're now going to go to Vicky Hogarth with CHCO-TV.
Thank you, Bruce. My question is likely for Dr. Salifou. The projection for hospitalizations in the near future is obviously quite troubling, but when exactly are you projecting Omicron peaking in the province, and can we take any silver lining from this massive spike of infections? Will this, combined with vaccines, lead to some form of herd immunity, and could we expect to move from pandemic to endemic at some point this year?
Thank you very much for your question. So just to ensure that I understood correctly, the question is about if or when we can expect to peak in terms of hospitalizations?
In terms of also cases, and if there could be some kind of silver lining to take away from that perhaps this could be going from pandemic to endemic. Is there anything that can come of this?
So what I can speak to is the models that would have been shown, and those are suggesting that we're in an upward swing for the next 2 to 3 weeks, peaking right towards the end of January, early February. And our expectation is that things would go down under our current measures and our current situation. Things would go down following that point in time.
Thank you, Ms. Hogarth. Sarah Derry, Radio-Canada.
Oui, ma question est concernant les personnes qui sont entrées à l'hôpital pour d'autres raisons que la COVID et ont contracté la COVID sur place. De ce que je comprends, ça serait 35 personnes en ce moment. Pouvez-vous confirmer ça? Peut-être nous dire aussi, est-ce que parmi ces personnes-là, est-ce qu'elles se trouvent aux soins intensifs pour la maladie? Et est-ce qu'il y a des mesures pour tenter d'éviter justement qu'il y ait plus de personnes qui contractent la COVID finalement à l'hôpital?
Merci pour la question. Peut-être que Dr. Dornan pourra compléter il y a différents scénarios potentiels pour ces 35 patients-là. Je peux parler pour le réseau de santé Vitalité. Principalement, nous avons autour d'une quinzaine de patients qui ont testé positif après leur entrée à l'hôpital. C'est souvent difficile de préciser si le patient a contracté le virus avant de rentrer à l'hôpital, est rentré asymptomatique pour une autre raison et est devenu positif après son admission, ou s'il a contracté le virus pendant son admission à l'hôpital. Alors, on se rappelle qu'il y a de la transmission communautaire partout au Nouveau-Brunswick actuellement. Un des endroits les plus sécuritaires, c'est bien dans un hôpital où tout le monde porte les protections en tout temps. C'est pas impossible de transmettre la COVID dans les milieux hospitaliers. Ça s'est produit depuis le début de la pandémie. Maintenant, dans nos soins intensifs actuellement, il y a 3 patients qui ont testé positif à la COVID et qui sont admis pour d'autres raisons que la COVID, mais ces patients ont testé positif dès l'admission. Donc, il ne s'agit pas ici de transmission nosocomiale. Nos 15 admissions positives, les 12 autres, c'est partagé et on ne peut pas identifier la cause pour chacun des patients.
Thank you very much for the question. Yes, I might have misled people. Some of the people that didn't come in for COVID reasons had COVID when they came in. And it's so severe, though, that we are now screening with testing all of our patients that are admitted, COVID or otherwise, because we know that some people have crept in for those reasons. Yes, we have currently 9 people in our ICU, 46 active admissions. And we would have liked to keep them on single COVID units, maybe even beefed up COVID units, but there are that many people now and projected that we have to start looking after people in other areas, but protecting them from non-COVID infected patients and staff. And we are really working harder to keep any nosocomial transmissions. I was in a lunchroom the other day. I had an opportunity to see activities happening in our heart center. And I went into the room to get a key. And I opened the door into the lunchroom, and I saw 4 nurses in the lunchroom, way more than 6 feet apart, all with masks on, just taking the mask off to have a bite or a drink. And when they got up to go to a sink or something like that, the mask was back on again, and we're cleaning their areas. So, we're doing all we can to reduce nosocomial transmission, infections amongst our staff. And generally, when our staff are infected or exposed, it's something that's happened in the community, less so in the hospital.
Thank you, Doctor. Merci beaucoup à vous deux. Simon Delatte avec l'Acadie Nouvelle.
Oui, une question pour l'épidémiologiste en chef. Finalement, la question de tout à l'heure, c'était de savoir si le variant Omicron on peut considérer que ce serait la dernière vague de la pandémie. C'est ce qu'affirment plusieurs experts, plusieurs responsables de santé publique également. Est-ce que c'est une prédiction que vous faites également?
Bonjour, M. Delattre. Donc, je ne vais pas me prononcer à dire si c'est la dernière vague de la pandémie ou non. Ce que je peux dire, c'est que les modélisations qu'on a en cours présentement, sous nos conditions actuelles, suggèrent une diminution suite à avoir atteint un asymptote, un pic, si on veut. Mais de là à dire, le virus continue à se muter, continue à changer. C'est pas la première, vous allez me pardonner l'expression, curveball qu'on nous envoie. Donc, de là à me prononcer à dire que c'est la dernière fois, je peux pas le faire. Le virus, je suis sûr, a encore d'autres manigances. Merci.
Doc Poitras, CBC.
Hi, good afternoon. This is for Dr. Russell. Some parents are looking for a shorter interval between doses for their kids aged 5 to 11 to protect them and also make a possibly sooner, safer return to school possible. NACI recommends 8 weeks, but that's based on adult data. It authorized 3 weeks based on Pfizer clinical trials. And in some provinces, parents can choose the shorter interval. I'm wondering why not here?
Well, that's a great question, Jacques, and I've seen that in social media, and I probably have some of those questions in my inbox as well. We are spacing it out according to NACI, is my understanding, but again, there's many factors involved in how we roll that out at the same time that we're rolling out booster shots for other populations. So it's really a balance of resources, et cetera, and ramping up as much as we can to protect everyone at the same time. So I do hear what you're saying. There are drawbacks to reducing that interval, so in terms of longer term immunity. So again, it's a balance of what we need to do to protect our population as a whole right now.
Thank you. Alexandre Boudreau avec l'Acadie Nouvelle.
Bonjour, est-ce que vous m'entendez bien?
Oui, merci.
Donc, j'ai une question sur les déclencheurs pour la phase 3. Un des déclencheurs, c'est d'avoir 100 hospitalisations actives ou 50 hospitalisations aux soins intensifs. Est-ce que la province a ajusté ces déclencheurs-là pour la phase 3 en fonction de la capacité actuelle des réseaux de santé puis du nombre de travailleurs qui sont en arrêt de travail?
À ce moment-ci, on n'a pas changé les déclencheurs, mais il faut rappeler que les déclencheurs ne sont pas les déclencheurs pour aller à la phase 3, c'est des déclencheurs pour avoir les discussions actives pour faire les décisions. C'est quelque chose qu'on discute chaque jour presque parce qu'on a les informations dès que les hôpitaux peuvent les donner à le département de santé et à santé publique. Alors, on est capable d'avoir cette information très proche de nous. On va continuer à surveiller très prochement et si c'est nécessaire d'avancer à la phase 3, c'est ça qu'on recommandera.
Merci beaucoup, M. Boudreau. Dr. Russell. We'll now proceed with Savannah Odd with the Telegraph Journal.
Hi there, can you hear me?
Yes, thank you.
I'm wondering, Dr. Russell, if you could give some guidance to those trying to understand how exactly to cut down on contacts so it will be enough. I guess, should people stop going out in public except for groceries or essentials? Should we be sticking within our own household? Is study 10 still okay? What kind of advice would you give to people making those decisions?
The simple answer is, you know, if you don't absolutely need to spend time with other people in any situation, then don't do it. So really try to keep it to the critical things that you need that are essential. Andre Picard actually just wrote an article in the Globe and Mail that really has a great way of framing your risks of contracting COVID in many different situations. So obviously, the situation where you go to few places as possible, with as few people as possible, and don't entertain people in your home, et cetera, unless you absolutely need to for care of a loved one, et cetera. So whatever the bare minimum is that you can survive with at this time is probably the best. But we know that varies from person to person depending on their mental health status and their physical health status.
Thank you. Héloïse Rodriguez avec Radio-Canada.
Oui, bonjour. Je regarde vos projections pour les hospitalisations et je me demande à quel moment ça risque d'être trop pour les réseaux de santé. Je ne sais pas si les PDG veulent répondre à ça ou le Dr Russell, mais en ce moment, on est à plus de 80. Il y a déjà beaucoup de pression, donc presque 200. Ça semble quand même assez difficile à gérer. Est-ce que vous avez peur que le réseau craque?
Tous les plans qu'on a mis en place sont des plans séquencés en fonction de la sévérité de la situation. On ne considère jamais juste un facteur pour juger si la situation est devenue modérée ou sévère dans les plans qui s'en viennent. C'est toujours plusieurs facteurs. Le nombre d'hospitalisations en est une. Le nombre d'hospitalisations aux soins intensifs en est une autre. Le pourcentage d'absentéisme en est un troisième. Et on en a quelques-uns d'autres qui sont moins majeurs. Alors, est-ce qu'on a peur? Tous les travailleurs de la santé sont dans un mode anxieux actuellement, c'est certain, mais on est prêt. Ce qu'on peut dire, c'est qu'on avait déjà un plan de pandémie de prêt. Ce plan-là, on l'a testé à plusieurs reprises. On sait qu'il fonctionne. On a bonifié notre plan. On s'est amélioré continuellement. Et on a toutes sortes de panoplies de solutions en séquence qui sont enlignées pour faire face à la crise de ressources humaines qui s'en vient et qui sera inévitable jusqu'aux scénarios les plus pessimistes. Donc, ce n'est pas seulement par rapport au nombre d'hospitalisations. Et je soulève simplement que le nombre d'hospitalisations aux soins intensifs en proportion est plus bas qu'avec le variant Delta. Donc, on s'accommode des comportements du variant. Et ce qu'on s'attend, c'est plus de patients dans nos unités COVID, mais pas nécessairement dans nos soins intensifs.
Merci beaucoup. Bobby Jean McKinnon with CBC.
Yes, thank you. Can you please tell us how many hospital beds and ICU beds Horizon and Vitalité each have and how many ventilators the province has, please?
Thank you very much for the question. I'm going through my paperwork so that I can give an accurate number of ICU beds. It's close to 100 in Horizon, but it's a fluid number. We have other areas that we can use for ICU purposes, for example, a post-operative care area. We have more ventilators than we have beds. And so we have a capacity to tolerate a high number of ICU cases. However, as Dr. DeRosier mentioned, it's not just the ICU care that we care about, it's the admissions that don't require ICU care that diminish our ability to give non-COVID care in our hospitals. So we have a fair amount of room to work in terms of ICU beds. It's the overall capacity that threatens us.
Erica Butler with CHMA.
Oh, hi there. Thanks very much. I had a question about the chart that shows the projected decrease in hospitalizations and cases depending on contact levels. There's scenarios there for reduced contacts, for certain percentages of reduced contact. I'm wondering, what's the correlation between those percentage reductions and the further measures that we have in our toolbox? And I'm thinking of level 3 restrictions. So I guess what I'm asking is level 3 expected to cause a 10% or 20% or 30% reduction in contacts among people? What is the expectation from that winter plan, that level 3?
Yeah, no, thank you for the question. Sorry, I'm hearing some feedback there in the, okay. So in terms of what we're expecting, I'll start by contextualizing a bit. The reduction or the proportion of reduction in contact rate is based on our current situation. So take whatever number of contacts that exist under our current level 2 measures, and you'd have to reduce an additional 10 or 20% based on the curves presented today from that. In terms of how much we expect the measures to reduce that contact rate, of course, the measures that we are putting in place or that are proposed through our level 1, 2, and 3 winter plan, aim at reducing that contact rate. How exactly it shakes down is always a bit more difficult to ascertain, but certainly things like a single household bubble down from a steady 10 would reduce that further. And that's the hope of those measures, if they need to be enacted, is to reduce that contact rate between individuals.
Thank you. Suzanne Lapointe with Global.
Hi, can everyone hear me?
Yes, thank you.
Hi, my question is for Dr. Desrosiers from Vitalité.
Okay.
So Dr. Dornan from Horizon mentioned perhaps bringing in staff from Vitalité. Do you have the staff to spare? And if so, why do you think Vitalité is faring so much better than Horizon when it comes to staffing challenges currently?
La situation ne sera jamais, la réponse ne sera jamais une réponse unique parce que la situation change à tous les jours. Donc, la réalité par zone, la réalité par hôpital ne sera pas la même partout en même temps à travers la province. Alors, la raison pour laquelle je cite souvent mes zones de Campbellton et d'Edmundston en exemple, c'est que ce sont les endroits où il y a eu le plus souvent d'éclosions à gérer et ce sont les endroits qui nous ont permis de tester notre plan de pandémie, de tester nos stratégies. Et ça nous a fait plaisir de partager les leçons qu'on a apprises à travers la pandémie avec nos partenaires en santé, dont le réseau de santé Horizon. Donc maintenant, Horizon nous a aidés par moment, nous avons aidé Horizon par moment et dans le futur qui s'en vient, on s'attend à continuer à agir de cette façon-là selon la réalité des différentes zones de la province.
Merci.
Laura Brown with CTV.
Hi there. Dr. Russell, I'm wondering if we are truly waiting until there's 100 people in hospital with COVID-19 to move to level 3, or if you are actually considering moving to level 3 sooner than that, despite not potentially getting to that trigger point.
Hi, Laura. You know, we would like to avoid having to go to level 3. It's the other part of this briefing today is really around what can the population of New Brunswick do right now collectively and individually to protect the healthcare system to avoid having us go to level 3. So it's, and as I mentioned before, our triggers haven't changed. The triggers are about having the risk assessment being done. We're following the situation extremely closely and we will continue to do so.
That concludes today's COVID-19 update for New Brunswick. I will post the numbers for the number of new cases today on our website as soon as I have them available, but keep in mind we don't necessarily have the numbers for the rapid test counts for today, and I will just be posting the PCR numbers and hospitalizations for the time being. But as you heard in today's conference, we are now at 88 people in hospital with COVID-19, and that's a new record for the province. Now, keep in mind, a change to level 3, a change that Dr. Russell said today is not happening at this moment, though the requirements to move to level 3 are still in place. That would see us with 100 people in hospital, then triggering a level 3 change, or again, 50 in ICU, though our ICU numbers still remain relatively low, despite the number of people who are in hospital at the moment. I will be posting some slides on our Facebook page that were talked about in the conference after this that will give you the graphs that Dr. Charlefou was talking about in terms of the projections. Keep in mind, he did mention that we would be hitting the peak of the Omicron variant nearing the end of January and early February. So hospitalizations are likely still going to go up for the next few weeks, and we are in this for at least 2 months of of really difficult numbers for the fifth wave of COVID-19. I do appreciate all of you who choose to join with us, and I very much appreciate the time that you take to spend with us for these updates. I'm Vicki Hogarth at the CHCO News Desk. Please look for a news report tonight that is a little bit of a summary of today's press conference. Thanks so much.
This has been a news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.